Hi there, my name is Claire O'Sullivan. I'm the manager here in Tinteán Housing Association, and I just wanted to come on here today to tell you a little bit about what we're all about in Tinteán and why it is so important to have the support of members of the public, why we are so dependent on it and so grateful of it. So I suppose first things first, Tinteán was set up in 1999 here in Waterford City. It came about as an identified need for homeless women over the age of 18. There was absolutely no emergency accommodation at that time. There wasn't anything like transitional programs for women, nothing like that. So there was a number of organisations that came together to make this happen, and it started off being a pilot project. Obviously a very successful pilot project, because here we are 21 years later. So it's changed a lot over the years. For myself, I joined as manager nearly 5 years ago now. So I would have had a lot of experience in different homeless organisations between my home county of Kerry, up the kingdom, and Waterford, my adopted county. But Tinteán really, I suppose, and being part of this organisation has really allowed me to kind of, feel at home in an organisation and feel it's somewhere I belong as a staff member. We have huge freedom, I suppose, in the direction that we want to take the service, in line with, I suppose, government recommendations, in line with the Housing First projects, the housing-led way of working. So there's great freedom in that. One of the best things about being involved in Tinteán is the service users that we support. Like if you look around Waterford, so we serve Waterford City and County, and if you look around Waterford in a day like today and the really cold snap that we've just had, and you think to yourself that there are people out in that weather, that you'd be absolutely freezing cold. Obviously we're in Ireland, so there's a lot of damp, so you have the damp on top of the freezing cold. That can lead to an awful lot of issues for people. You throw into that mix then a pandemic, a global pandemic that we're in, COVID-19, and you have service users who are incredibly vulnerable. So we would use the term for the service users in our residential part of the service as requiring shielding. So that's what we do with them, is we cocoon or we shield those service users. We have people in our main service who come to us in active addiction, or they may come to us in the very early stages of recovery. So they may be stabilising on the methadone programme. So because of that, we work hand in hand with agencies like the Substance Misuse Clinic. We really form part of a multidisciplinary team. I suppose research would suggest that the best way of working to get the best quality outcomes for our service users is that wraparound support, the multidisciplinary team, the interagency approach. So that's what we do. We absolutely find it gives us the best quality outcomes for them. We'd also have service users then who would have underlying mental health issues. They may or may not be compliant with mental health services. They may or may not be compliant with mental health medication. So a big part of what we do when they come to us is we help to link them into services if they're not already linked in. We're very much aware of what our own limitations are, and we're okay with that. A lot of people might talk about, we're the be all and end all. We're not, very much not. People come to us for a service, we provide the service, but we know that we need to link them in with the addiction specialists, the mental health specialists. We need to work with the probation officers very closely to look at reducing offending behaviour. So by all of us working in Waterford in that way together, we provide a really good service to the community. We help people turn their lives around, absolutely, literally. So we may have a woman come to us who is totally disconnected with her family, any social network that is any way positive for her. So, and one of the major issues that we find, because it's all women in our residential part of the service, is any woman that we have in the residential part of the service where they have children, and a lot of them do, they're separated from their children. Our women are very aware that there's a lot of stigma around that. If you're a woman who is now living without your children are in the care of your family or foster care or whatever, there's an awful lot of stigma around that. There's an awful lot of judgment around that. We see the other side of it. So we see the woman who is absolutely grief-stricken because they're without their child. They're still a mother. So then Mother's Day comes around, Christmas is coming now. So their biggest thing is, what is my daughter or my son doing now? What little thing can I get to let them know that I'm still here and I'm still thinking about them? Not one of our women wants to be without their children and without their families. So it's a very lonely, isolated place to be. So coming up to Christmas, our big thing is to try and make this a home away from home. Nobody ever wants to come into Tinteán. no matter how lovely a service we provide, nobody actually wakes up in the morning and says, I'd like to be homeless and I'd like to be living in Tinteán. So we know when somebody comes into us, there needs to be an exit path very quickly, so that you're coming in for up to 18 months, but we're immediately going to start looking at where are you going to go after that, so that you're secure for your life. Our funding then, our funding structure is, our staffing is covered through the HSE for myself and the project workers, and then our shift attendants and relief staff who cover the evening, the nights and the weekends, they're funded largely through Waterford City and County Council. Absolutely everything else then is down to ourselves. So we do have very limited rental income, and outside of that it's fundraising and donations. So for instance, the heating, the electricity, the printing, the postage, the stationery, our refurbishments on our properties, our repairs on our properties, if the boiler blows, whatever the case may be, that's all down on us. Also then, if we want to run programs for our service users, so we do a load of programs, we do group work and individual work, anything that we want to fund, that largely comes down to fundraising and donations. That's massive. Even if it's something like, at the moment, in this weather especially, it's very, very difficult, say, for people, depending on where they're at with their health, to even access their appointments when they do get appointments. So if we're able to fund a taxi to help them to get to their service in the hospital or the addiction clinic or whatever, again, that's where our fundraising and donations come in. So every single cent is very much appreciated. We are so grateful to BuskAid for every year thinking about us, and I suppose keeping it local, and we very much consider them at this stage like part of our extended family, which is absolutely wonderful. For them to think of us and to put this effort in during a pandemic to see, well, how else can we raise money for Tinteán, is just huge. So I wanted to come on and say a massive thank you to the members of BuskAid, and also especially to every single member of the public that sees this and might make a donation. Doesn't matter how small, everybody is stretched this year and we totally are aware of that, but together we can be mighty.